Welcome to another exciting segment of A Talk with Your Fertility Specialist. I'll be your host today on the show, and my name is Esther Benjamin. So, today with me, I have some fertility experts from Alps Hospital and Diagnostics, and seated to my left is Dr. Kenneth Aguba, and to his left, Dr. Deborah Olibiyi. So, viewers, I'll just give them an opportunity to say a little about themselves and what they do at Alps Hospital and Diagnostics.
Hello, viewers. I'm Dr. Deborah Olubi, as she has mentioned. I'm a family physician and IVF specialist. I'm the head of the IVF unit at Alps Hospital and Diagnostics.
Oh,
Yes,
amazing.
for me, Ken, I really don't know how to introduce myself
Oh, feel free.
because,
Anyhow.
yes,
Wear
so
a lot of caps.
yeah, and that's just the reason why I don't know how to introduce myself.
Okay, so.
Well, in a nutshell, I'm a consultant gynecologist,
Okay.
an IVF specialist, a minimal access surgeon, reproductive biologist.
Okay.
Yeah, I work for Alps Hospitals and Diagnostics in the IVF unit and in the gynecological unit. So I do all around the woman's life.
All around the woman's life. Oh,
Oh,
wow.
yeah.
Okay, so do you have any passions in these areas?
Yeah. The passion in this area for me is preparing a woman for an IVF treatment cycle.
Okay.
Yeah, because from my trainings and walking around the globe, one major area I find very problematic is having women undergoing IVF treatment without adequate preparations. Preparation in terms of investigations and very detailed investigations, okay? Like looking at the uterine cavity where you're going to drop the embryos, or looking at the sperms of the man to be able to forecast how easy it will be for the sperm to bring about the pregnancies and all of that. So, yes, so endometrial health, the health of the uterine lining in preparation for pregnancy is the area I'm basically in love with.
Oh, amazing.
But
Okay,
yeah.
so since it's a ladies' world, I think I would allow Dr. Luby to just tell us what are these investigations done prior to an IVF treatment, or can a couple just come and then immediately have an IVF treatment?
Thank you. So IVF is not fast food. A lot of people think it is. So they just come into the hospital and think an IVF treatment will start.
Okay.
No, a lot of preparations and evaluations needs to take place for us to get the best outcome. So the clients are seen, you take a detailed history, they're examined, and a lot of investigations are done. Some of the investigations we need to do, we need to check what's the hormonal, environment that these eggs are being produced in. So we do an hormonal analysis for the man, for the woman. We do basic investigations to screen for different infectious diseases. We want to do a scan. A scan is very paramount to look at the uterus, look at the endometrium, look at the ovaries. Even from a scan, you can see a lot of pathologies and reasons for why they're not able to get pregnant spontaneously.
Okay.
Yes. So there are a lot of investigations. The levels, the investigations you do for a couple is not the same. Those are some of the myths that clients come in with because they've had a friend or family member that assessed IVF treatment. They think it's the same thing that will happen for them. Everybody's story is different. Is different. Everybody's problems are different. Yes. So those are some of the investigations we do.
Let me just chip in something here.
Okay.
There is no limit to the investigation, as a matter of fact.
Okay.
The investigations are tailored to meet an
Individual
individual's
need.
medical history.
Okay.
Exactly. So, just as I should mention, and these investigations may differ for different clients. You understand? So, a woman may be asked to do a sugar test, for instance, because she has history suggestive of abnormalities with sugar. A woman may be required to do a hysteroscopy as part of the investigations because probably in her history there is something suggestive that the lining of her uterus may not be in a good condition. She may have had surgeries for fibroid removal previously. She may have had a D&C or evacuation. So these are subtle interventions on the uterine cavity that may affect the health of the lining of the. Remember, I said my passion is analyzing those aspects, because when you've generated healthy embryos,
Yeah.
it's just not good enough. The environment wherein these embryos are going to be kept to give them ability to become pregnancy is very important. And now this is the area that even gynecologists don't know how to interpret the health of an endometrium. Seeing just an endometrium looking the way it is, if it have not been trained in the pathology of the uterine lining, you cannot be able to explain how healthy a uterine lining is. And so a lot is going on there. And for me, I've been privileged to be trained by heads of endometrial pathology across Europe, beginning from Barcelona to Bulgaria to the
Amazing.
United Kingdom. We just keep watching the uterine cavity. No matter as healthy as they look, sometimes you could just see subtle abnormalities that may not be, that are not just what you cut off with scissors, but you have to do other things to make them healthy enough to attempt to be pregnant. And for the man, we check the sperms, and then the problem is that a good number of clinics, for instance, see sperms and just classify the man as okay.
Yeah.
And they think that because you just see sperms, it means that a man can just father a baby, father a child, But then when the andrologists look at these sperms, what they see is different. They see quite a number of abnormalities.
Yeah.
And sometimes these sperms are not even good enough to go through the regular selection process or the screening. And so we use all of these to forecast how easy pregnancy can be for this couple. The thyroid function tests are also important because
that's
a
a
woman
lot.
may look okay. Reproductive hormones may be fine, but the thyroid hormones may just be different. May just be abnormal. And then this may be responsible for a lot of miscarriages within the first few weeks of an IVF treatment cycle. So the investigations are a lot. And so a woman or a couple shouldn't just feel that they just
Once
come
they
into the
appear,
clinics
they can
and
have
just have an
treatment.
IVF just
Immediately, yeah.
It differs. Some can have it immediately. Some will need abnormalities to be corrected and treated for a month, 2 or 3. She mentioned ultrasound scan.
Yeah.
During the ultrasound scan, some women may have fibroids, polyps, and adenomyosis, for instance. And these are these are pathologies that may require 3 to 6 months to be cared for. And so you're just walking into the clinic, and then you expect you're going to have an IVF treatment.
Just
Then you meet a
immediately.
doctor like us telling you, hey, there's a fibroid here, it needs to be removed. There's a polyp here, it needs to be taken out. There are signs that you have adhesions in the uterine lining, they need to be evaluated and see. So sometimes it takes 3 to 6 months
Oh, amazing.
before you are even ready
to have
to
an IVF
start
treatment.
an IVF treatment cycle. So when you're coming to the IVF clinic, you're just going to come with an open mind.
Open mind,
Yes, we
yeah.
know what you're coming for, and we're ready to do that for you immediately, but not before a detailed and corrective procedures have been done.
So it's compulsory that every client has to go through this investigative process.
Yes.
It's advisable.
It's advisable they go through it. That's what's increased. What's the outcome we're all looking for?
Pregnancy, yeah.
So all this investigative process helps to increase our chances of achieving that. So it's advisable they go through the investigative process. And it helps us to know who we're dealing with, know their health status, know the issues that have been preventing spontaneous pregnancy and how to address it, and to tailor the IVF treatment to help them accomplish their desire.
Oh, amazing. I've seen clients where they say they're in a hurry, probably they want to travel outside the country, and then they just have like 2 months or a month to prepare and leave the country and all.
I have a lot of problem with this, okay? Because most times we have a lot of clients coming from the United States, coming from United Kingdom, England, Finland, and all of this. And of course, you see, life in this society are usually regimented lives. The work conditions are very stringent, very strict. You can't just leave, go do some stuff at any time. You have to wait for your leave. Your vacation, which is usually 3 to 4 weeks, and then they start making all these plans. Hey, I'm coming to Nigeria, I'm coming to Alps. And then the nurse coordinator of IVF talks with them. try to get them all ready, and then you request that do this and all of that from the US, from UK. Say,
Like, I don't
no,
have the
the,
time.
the, the doctor said I'm fine,
Yeah.
and then they think that because they're coming to Africa,
Yeah.
and that
Everything
because
should
the
move at
doctor
the
over
pace.
there
Yes,
says they are fine,
yeah.
we're going to certify them to be fine here.
Yeah.
It's just not so.
Yeah.
So they come down, maybe stubbornly calm down, and then you only check and find out that a lot of things are just not okay. I remember quite a number of women I have to turn back to wherever they came from, United Kingdom, because I guess it must be the GP or a gynecologist that is not a reproductive gynecologist who evaluated them and said they are fine. Just sticking in a scan into this human pelvis, and then you find little fibroids that are not just intramural, but they are at the lining of the uterus. And that means she needs to have a surgery. Hysteroscopic surgeries, laparoscopic surgery, or even open surgery to address those fibroids. This technically means she is not fit
for an
IVF. Because if you do whatever you're doing there and you keep a baby in this uterine lining, she's likely going to have failure. Or she gets pregnant and soon have a miscarriage. So we have to turn a good number of them back home because their paid vacation would not cover the time for this care. So, we have all this discrepancy. So sometimes if they say they're okay, we'll say, okay, can we recommend that you would see a gynae to have a hysteroscopy? Or let's have your sperm analysis. So we cut down the number of days or shorten the time you're going to have to spend in Nigeria for all the extended evaluations you have to have. So yes, it's a very big challenge for us.
Yeah. So I think you're able to handle it well, properly with what you've said. And then it's beautiful that you know what you're doing, right? Because a lot of times, like you said, over there, they just assume that African doctors don't really know what they are doing per se. But then it's good that Dr. Ken and his team have.
Yeah, for reproductive medicine, both African doctors and the Western doctors have a similar platform where we all train, okay? We have similar platform where we train. And then, as against the European society, for instance, where you become super specialized, in Africa, for instance, we are also super specialized, but we have a broader knowledge, of this aspect because we tend to carry so much on as we go on with our training. And so, just as I described myself, I'm a minimal access surgeon. I'm an intrauterine surgeon.
Wow.
I'm a gynecologist. I'm an obstetrician.
So many caps, Dr.
So many
Ken.
things that I have to do, Yeah, all because of the environment you find yourself. And I'm a reproductive biologist at the same time. So when I'm evaluating a woman, for instance, I see her with multiple eyes. I see her hormones because I understand reproductive endocrinology. I do surgeries, so I know when she needs surgeries. I know the health of the uterine cavity. I know when the problem is going on there. As against other society, if a gynecologist sees you and he feels you need hysteroscopy, he sends you to someone who will do the hysteroscopy. And then the person carrying out the hysteroscopy may not be a reproductive gynecologist. So you find that there's always going to be this gap in your care. Because if I'm doing hysteroscopy, for instance, I'm a reproductive gynecologist doing hysteroscopy, I give special attention and care to the kind of energy I use in the uterine cavity. Because, for instance, if you use a resectoscope, for instance, cutting off fibroid during hysteroscopy, you could leave adhesions. I may choose to use a laser because this woman is looking for pregnancy, because laser leaves little or no adhesions in the uterine lining.
Wow.
You see, but because I'm a reproductive gynecologist, I'm a fertility specialist, so it helps me, it guides me on how to deal with different situations. But of course, if a woman is not interested in pregnancy, for instance, I can use any kind of energy in the uterine cavity and just give her the health she wants at that point in time. So yeah, that's what it takes to actually prepare for an IVF.
Amazing. Well, just as a way to wrap up, Dr. Debbie, are there diets? Because I've heard clients say that, can I eat pineapple before an IVF treatment? Can I eat this? Can I eat that? Are there diets that a person must avoid before undergoing an IVF treatment?
Treatment, yeah. Like you mentioned, pineapple. There are lots of myths out there about different things affecting pregnancy, conception. But eating a healthy, balanced diet, just encourage them to avoid alcohol, smoking, use of some creams like bleaching creams. Those are some of the things that can actually affect. But they should live their normal lives, eat a healthy diet. And in preparing for an IVF treatment, another thing that is important is the counseling. These clients need to be adequately counseled. We need to tell them, like you said, some come and want the treatment immediately. They need to know that this is a process. It might take some weeks. They need to be counseled so we know the ideas and misconceptions they're coming with. Because if people come with a lot of misconceptions about IVF, we try to correct that during the counseling process. Yes.
Okay. Yes, still this diet.
Okay.
Sorry, I have a lot of experience about this. So most times I just feel I have something I need to say. Sometimes it's just almost midnight and you just get this call. Okay, this phone is ringing and the kids are wondering, is it going to pick the call or not? Of course I'll pick the call. And then you hear these questions. Sir, can my wife eat okra? I'll say, come on, man, we had to eat again, and then, can she eat yam? I was like, all right. Sometimes you want to get angry, but of course, the questions are just innocent questions, And then, can she eat orange? Yes, these are all food items or food materials or substances that women have criticized. That if you want to get pregnant, don't take orange, don't eat pawpaw. Pawpaw is papaya, carica papaya. Don't eat so many things. Yes, we know food has importance, with reproduction. And studies were done actually. And then the only aspect I know I can always advise about is that westernized diets reduce chance of conception. Now, what are the westernized diet? The processed food. Now the processed food could be things like the meat pies, the flour, and all of that. So, advice after such studies is that those that eat natural food tend to have better chances when all conditions are fine, because you could eat every natural food and you have problem with the lining of the womb, and then you don't achieve pregnancy. So you could do a whole lot of things, and then you can't just blame everything on food. So everything just needs to be okay, and you have to eat right, and more importantly, you have to have good state of mind while preparing for IVF. Because you see couples fighting sometimes, blaming themselves in the consulting room, passing the blame to this, passing the blame to that. No, it will rather make for failure. For us, for instance, when couples don't agree with themselves, we tend to ask them to take some time off, go get some counseling, be at peace with yourself, be at peace with you as an individual, forgive yourself if you have to forgive, and have a peaceful state of mind, because it helps a lot when it gets to do with pregnancy. So yes, food does. So when they ask the individual kind of food, I say, okay, I'm not a dietitian. Let's recommend that you go see a dietitian because we know food has some effect. See a dietitian. But I thought you asked about sex.
Yeah, I was going to ask about that. There's this misconception that a couple cannot have sex while undergoing an IVF treatment.
The truth is that they can have sex.
Okay.
They can have sex, but then this at their own expense. Okay, there's risks having sex. Now, how do I mean? When you're doing the preliminary evaluations for IVF, you could have as much sex as you want, but then there are times where sex should be restricted.
Okay.
For instance, after just the immediate period following embryo transfer. Oh, wow. What does sex do? At the height of orgasm, for instance, you have a contraction of the pelvic floor muscles. You understand? And then the uterus also contracts.
It can lead to an expulsion.
Yeah, and that is why sometimes you have pain after intercourse, lower abdominal pain after intercourse, because the uterus could be contracting. and it depends on the height of the orgasm, you could have very bad pains. And then you just deposited embryos, primitive cells, into these uterine cavities. They've not been established already. You understand? They've not even become pregnancy. They could just be forced out. And then when pregnancy occurs early, it's also a good time to avoid sex because implantation is just happening. And then when you have all the contractions following sex and all the waves of the uterine lining, it may not be in the best interest of the implanting embryo. So
It's advised that during that
advice,
period.
stay away from it until the gynecologist
So.
says otherwise.
Okay. All right. So thank you, Dr. Ken. Thank you, Dr. Devin.